The MEC resigning, it was very cowardly of her. After all this mess, it was very cowardly.
What would you have liked to have seen done?
She should have been fired. In fact, she should have been suspended the minute she said 36 people passed away. And you know, I suppose you can't blame the premier, but I still think he's kind of like getting off very lightly. Because as your principal, you can't tell me you don't know. You can't tell me you can't demand information. You should have suspended her, and for her to resign the day before the thing, after delaying it so bloody long and then resigning, it's almost like I'm angry.
So you don't feel that justice was served?
No, it's not. And I'm going to continue with, you know, obviously we need to consult as a committee, but I think we need to take the necessary legal action. If you're going to get an SMS that says today that your sister's been moved, the facility is closing today, and then you give a number that actually does not work, already just that whole process, that little thing there already tells you they didn't consider her because she's ill, she's sick. So how do you move somebody and you didn't tell the family? Because, you know, my sister was the type of person didn't like new environment. She didn't. A condition wanted her to be in a place, at least if her family members there, then she felt safer in a new environment. So to move her, not even let us know or tell us, come be with her and take her to a place. We didn't even know where she was being moved. I phoned for 2 weeks just trying to locate her.
This shouldn't happen again. And it's a lesson to our government to take it from there. And we are saying, we are learning something that the government of the people, for the people, by the people, should do consultations, should employ qualified people. And we come up with a suggestion that now all positions must adhere with the qualifications, especially the MEC should have been a medical doctor. And because of the lives of people, as much as we know nationally, the Minister of Health is a qualified doctor. Our family members were healthy and perfect, only affected by psychological and mentally retarded, but they were not sick. So in that sense, we say the government should account because our people were in their hands. Their lives relied on their medicinal care. And we had the hopes that we put into their hands and they were in the safe hands. Whereas they were put into people who were disorganized, people who were not following the administration, who were not in line with the constitution, and therefore we are here saying that now this is a wake-up call. This is a lesson. And of course, we don't end up there. We say now we would like to know the way forward, what the government is going to do, and this should not be repeated.